Recovery after brachioplasty is fairly low maintenance. There are no drains. You're gonna have sutures and staples along the inside of each arm. I know that it sounds barbaric that a plastic surgeon would put staples on your brachioplasty scar, but I assure you that it makes the final scar and final healing better in the end. So the thing with a brachioplasty is that the skin on the inside of our arms is very thin. And I want to make the skin fairly tight because that's what you're paying me to do. So in order to make the skin nice and snug and give you the tighter arms that you want, while still getting that thin skin to heal, which is holding all of the sutures and all of the tension, I find it safer to use a few random staples along the length of that scar, and we remove those staples within the first week because I don't want you to have staple marks on your arm permanently. So you're going to have a combination of sutures and staples. The staples are going to come out within 1 week, and the sutures that if they need to be cut out will be removed after about another few days, usually around a week and a half. Sometimes if your skin is thick enough, I can do buried sutures or all buried sutures. Sometimes people's skin is so thin in that area that I do some buried sutures, but it's just not enough, so I need to do exposed sutures as well, followed by a few staples. Again, the goal of this is to give you the best final scar and result, and I don't want you to be short-sighted about what sutures, staples combination we use. We just need to use whatever is best to get that area of the body to heal as well as possible. To care for that area, what I want you to do is just keep it clean with soapy water. If a brachioplasty is the only thing you had done, you can shower for 24 hours. Otherwise, refer to the other videos regarding the other procedures you had done. In general, if you don't have any implants put in your body and there's no risk to expose an implant, you can shower for 24 hours. I still don't want you swimming or taking a bath for 3 weeks. Keep the incision clean with soapy water and moist with Aquaphor or bacitracin. Don't let it dry out. We're going to give you some sleeves to wear for compression. You need to compress your entire arm from your wrist up. If you only compress your upper arm, the rest of your arm may swell, but you can experiment with whatever is comfortable. You don't have to wear any garments. Technically with the brachioplasty, it doesn't matter all that much, but I do find your recovery will be a little bit faster and the swelling will be better and less if you wear a compression sleeve that goes from your wrist all the way up to your armpit. And we will provide those for you. If you want to get some extra ones, I'm sure there are athletic compression sleeves made by Under Armour or other things like that on Amazon. As far as activity goes, after we get your sutures and staples out, everything's out, which is around about a week and a half to 2 weeks. If everything looks good and is healing up, you can go back to doing cardio. I don't want you doing a ton of arm exercises, such as curls, because that would put extra stress on that healing incision. But we'll give you the green light to exercise usually about a week and a half, 2 weeks once everything is out and if everything looks good and is healing. The other thing you can do to make your scar look better is put paper tape on the healing scar. So we're going to give you a roll of paper tape to put on your incision, which will become the scar, and we want you to keep that paper tape on that incision for 6 weeks after surgery. So take a shower, go life as usual. If the tape peels away, take it off, put on another layer. The goal is to have tape covering that incision for 6 weeks after surgery, which is usually about an additional 4 weeks after the staples and sutures are out, because it really helps the final scar look better. Then at that 6-week mark, so say the first couple weeks you have sutures and staples in your arm incision, then after that there's nothing, just dissolving sutures underneath and paper tape on top. Then at that 6 week after surgery mark, when you stop using paper tape, then we will laser those scars to make them look as good as we possibly can. Last thing you can do is wear sunblock. So nothing makes scars look worse than sun exposure during the first year when the scars are maturing. So make sure that if you're out in the sun, put sunblock on that area. Fortunately, that area of our bodies doesn't get a ton of direct sunlight, but while you have healing scars there, you should absolutely apply sunblock. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.